right, so quo is actually collagenase clostridium histolyticum, which thank God they came up with the name quo, because that was going to be real tricky for us. That's a big mouthful. So to give you a little background, I have been doing this type of work now for 25, 26 years. Excuse me. Every single week of my life, I've had a conversation about cellulite. And it's whether it's family and friends that know what I do or customers here, we'll be talking about faces and wrinkles and necks and everything that we talk about, and they say, what can you do about this? I work out, I eat right, I do everything I can do, and I have all these dimples, and I don't know what to do to get rid of them. So in my history, we used to do some really barbaric type things for cellulite. We used to wrap you in some pantyhose and use a really high-powered vacuum on you. It has a name and it's still used, so I'm not going to call it out mean, but it didn't do anything much. You know, we would do it. By the time you stopped being sore from that, the cellulite was already starting to show up again, and so it was just a repeat thing. And then we had some people that would come in and have it surgically excised. So we would go in and actually surgically cut the little cellulite dimple, but sometimes you didn't scar so pretty from that. So that was kind of a mess too. So it was just consistent. If we had something for cellulite, it didn't work for very long, and then we had to come back and repeat it, and people would get real frustrated with that. So when I was doing my research and saw quo, I was like, oh my gosh, I was so excited. I went and told the staff, we've got something for cellulite. And so I called, they put me in touch with Brittany, and she said, oh, I'm sorry, we're not giving this to just anybody. So we're gonna have to see if you're worthy of having quo, is how I heard it. And I was like, wait, do you know who we are? We're top 250 almost with Allergan at this point. We've got a great reputation. And she said, well, we're not giving it to every practice. We're rolling out slowly. That way we won't get back ordered. We won't cheapen the product and have people using it that don't know how. So we had to wait. It was a few months we had to wait, as she called and gave us the blessing. And so we finally, at the beginning of the summer, started training with quo. As with anything that we bring into About Face, we're going to bring it in slowly and safely and make sure that we do enough models to know that we feel good saying it works. We do it on a few of us so we know exactly how it feels with no, oh, it's okay. No, if we do the staff, they're going to tell us exactly every ache and pain and every bruise, and we're going to hear the whole story. So that works out very well. And we have been so pleased with our quo results. It's been the first thing that's ever really blown me away with quo. The company has a great reputation. This product's been studied more than any other cellulite product that we've ever seen. And Brittany has been amazing at talking with us about our clients and different questions that we have, because it is a new product, and she has seen it more than any of us have at this point. So we've felt very safe, and it's been a very effective treatment. Quo is an injectable treatment. So as I said, we've had machines, we've had surgeries, but this is the first time that we've had an actual injection. And as I think I heard Brittany mention, if those of you that have ever had Botox or anything like that done before, it appears that it feels exactly, I haven't had this particular treatment done on myself yet, but they tell me it feels a little like Botox, maybe even less sometimes, because your bottom's not as sensitive as your face. It is intended for adult women. Did y'all know men don't get cellulite? I did not know. They're just set up biologically different, and there again, they got lucky. They do not get cellulite.
Their participation, everything is fun.
Right. So cellulite is natural. It's a natural part of a woman's biology. So you can't beat yourself up about cellulite. It's just because we're women. Not every woman gets it. They say 9 out of 10 women have complaints of cellulite. And I think about 84% enough to do something about it. That's why a lot of us are here. And so as we start to get a little age, our skin starts to thin down a little bit, and the fat cells that we have start to enlarge a little bit. So you have the striae, see the purple parts there, and that's the dimple. But the fat is still there. So the fat is wanting to go sideways, but it can't. So it's going the path of least resistance. It's going to go up. So that's why you see that uneven texture in areas where you have cellulite. So typically we see it primarily on the bottom, sometimes on the thighs, and sometimes other places, but that's usually where we're troubled by cellulite. So who is a good quo candidate? Of course, we don't want to try this while you're pregnant or breastfeeding. We'll just wait until that project's finished, and then we'll worry about getting your body back. So that's always something that we wait until you're in the clear with that. Bleeding disorders, just because whenever we're working with Quo, we're breaking down the collagen fibers that are holding that skin, and you have a certain amount of blood vessels in those collagen fibers. So in breaking down that tissue, those fibers are going to break down, those vessels are going to break down, and it's not a traumatic bruising, it's more an oozy bruising, like we've broken down those vessels and so those vessels are just leaking a little bit beneath the skin. So if you've read anything about Quo, you may see that there is a little bit of bruising that comes along with it, and it can be impressive bruising, but it doesn't hurt like impressive bruising, if that makes sense. If you were to be in, like I say, a car accident where you get really banged up, you're going to be really sore and not want to move. Where you might be a little tender with Quo, but it's not going to be the type of bruising where every time you knock it on something, it's really painful. I think it was a little uncomfortable for a couple of days, according to our model, and we actually have one of our staff that's mid-treatment here that can talk to us a little bit about that. I also want to talk a little bit about this. Sometimes people say, oh, I have all this cellulite. And so we take a look and it's not actually cellulite. So this is perfect cellulite. And there again, it's just a little blurry. But you see, she has nice tissue, but she just has a few dimples scattered in that tissue. This is a different story. So these two people, they have probably some cellulite dimples you can see there, but they have a lot of laxity in the skin, particularly the one on the left. So we're going to have something to address the laxity. We're going to have an injectable treatment that addresses that laxity, but I'm not talking about that today because I find if I start bringing in too many products and too many different things, you're going to look confused, and it takes us a while to straighten everything out. So for today, we're just talking about addressing cellulite. But if you had this situation where you have some laxity and you have some dimples, you may still be a Quo candidate. We just have to look at your pictures together and see, okay, is this part what's bothering you? Is this part what's bothering you? If it's the whole package, do you feel like you want to see these dimples be a little smoother, or is it just that lax skin? So you see what I mean? We may have to take some photographs and kind of talk through what we're looking at and then make a plan. So with Quo, what the company intends is that we can take you back 2 degrees of cellulite. So primarily we're working on 3 and 4, these two on the end here. So we're hoping if you start out a moderate, we could take you down to be in a level, hopefully a level 1, where you don't have a whole lot of dimpling. If you're severe, we're hoping that we can take you down a little bit to be more like the mild picture, where you'll still have some unevenness, but it's not the type of unevenness that's going to really stand out so much, and certainly not the type that you'll see through your pants. You know, we see a lot of people that they don't really care what their bottom looks like naked anymore, but they don't want to see the dimples through their workout pants and their tighter pants. If anybody has 0, we want you to drop it right here because we've never seen one, and we would love to see that. And no matter how great, right, a 5-year-old is what Brittany said. Yeah. So when we're doing Quo, this is just a little picture of how it works. Those septi are running towards the top, attaching to that skin. So we actually work inside the dimple. So whenever we're getting ready to treat you, we'll make a little circle around the dimple because when you lay down, everything looks perfect, right? So we don't want to try to treat you at that point. We take the center of that dimple, and we know in the center of the dimple is where that septi connects. So we're going to go in and we're going to give it a little injection and a little shot of Quo in 3 different directions. So we're hitting those septi and starting to break them down. And over time, we see the septi start to dissolve. And you see the little blood vessels in there. So that's what we're talking about. When we dissolve the septi, we also break down a little those little fine blood vessels. It's not affecting your blood supply, but it's just the ones that were wrapped in that tissue that we're actually breaking down. And so you see how the skin will be smoother. So it actually breaks down the septi. It'll redistribute the fat because the fat, rather than having to come up and make that bump, is now able to go side to side, be a little bit smoother. And then we're also producing a little more healthy collagen in there. So what you need to know before you Quo. You'll have bruising, and you know, we keep talking about the bruising, but you just don't want to surprise somebody. We could treat the bottom and we could treat the thighs. The bottom you might be able to cover up with a swimsuit, but if we treat your thighs and you go on a nice beach vacation, that's just going to show. Yeah, you don't want to go walking down the beach showing your bruised fanny. So we just want to make sure that we work that out. We actually need to do 3 treatments. So we're going to do 1, And then we're going to do the next one 21 days later and the next one 21 days later. We do 21 days because we don't want those blood vessels to have time to grow back and have to go through all that bruising. The bruising will actually decrease over time. But once you get those 3 treatments done, you'll see that the bruising is decreasing each time that you do the treatment. And it usually subsides in a week or so. Some people are going to have some shadowing after that. Some people don't bruise quite as much. So we can talk about the things you can do to sort of mitigate that bruising from ever starting and getting bad. You stop any blood thinning supplements a week before treatment. Now, if you're taking a blood thinner from your physician, we need to talk about that. We don't want to take you off of any of your medications that you have to take. But if you're just taking omega-3s because you want to, glucosamine, magnesium and turmeric are big ones right now, you might get a little more bruising. And that bruising's not going to hurt anything, but if it's, you know, something that we don't want to have happen and you're taking it and we don't realize it till you get here, then we can just help you, you know, maybe wear some yoga pants to wear a little bit of compression there, maybe use some ice for the first couple of days, and then maybe some warm compresses, not hot, to kind of help that bruising to go away. And you can resume normal activity. There's no restrictions with this. So if you want to have this done and you feel like going to the gym, you can go. You don't have to take time off of regular life. We've heard that a couple of people have been a little bit sensitive after, so you might not feel like working out for a day or so, but it really hasn't stopped anybody from going about normal activity. So we're going to let Tara get ready to go. This has been a very simple, straightforward, it's a little bit like Botox where we reconstitute it here in the practice with the diluent, get it ready to go. And so there's really not been a lot that we have to learn. And it's been studied so much and it's been proven so safe that we feel really good about the product. I am going to let you guys... Let me just make sure there's nothing else I want to tell you, because I'm going to let you guys actually gather in a little bit closer there if you want to see.
We're going to refill as the ladies.
Okay, we could take a refill break. So while she's getting set up, let me say we will do the 3 treatments, 21 days apart, and then we'll get back together at day 28 to talk about what it looks like. Take pictures, see what it looks like, make sure that we're all happy with the result that we see.
Okay. Do you ever just treat the thighs?
Yeah, we can treat the thighs. If you don't have any dimples on the bottom or you're not worried about the dimples on the bottom, we can absolutely just treat the thighs. Thighs have done beautifully well. We really like that. So normal things to feel after the treatment. Minimal discomfort, of course. Itching can sometimes be a problem. If you think about it, blood, you know, if you have a blood under the skin, like you have a real surface bruise, it can be a little bit itchy. So that's just that blood underneath the skin. Yeah, it's just a healing kind of a feeling, yeah. And so that would be normal, and so would firmness. Little nodules, and that happens, you know, if you have ever had Kybella or cool sculpting, sometimes you'll feel a little bit of firmness when tissues are healing. We call it induration. So I always like to mention that because I don't want you to think, oh no, I've got lymph nodes, you know, that's normal. You've just got a little bit of healing going on in there. And bruising for about 84% of clients. So these are some of the results that we've seen from Quo. These, of course, aren't all of our pictures because our people are coming up on their 3rd treatment at this point. But so we contacted our peers and just talked to some other practices to see that have been granted Quo earlier than us. So they had a few more results. So you see, that is a nice change. To see your bum look just a little bit smoother like that. It's not perfect, and that's what I want you to see. We're not going to make perfect, but in the past, there's a couple of people that I've been just putting a little filler in that one void spot, and I can imagine if they were still troubled, it'd be a whole lot easier to work on tightening skin and tissue and working with skin laxity after we get the skin smoother, get that fat redistributed. This one I like because look at the difference in her exercise pants. And that's something that I hear from a lot of people is I go to exercise and all you see is dimples in my swimsuit or in my yoga pants. So I'm gonna actually let you guys, if you want to come take a look at Lori. Lori has donated her body to Quo for us today. So Lori is an old friend of mine. I've known her through About Face for many years, and she has done her part with working out and done everything she could do. She mentioned Cellulite to me recently, and I said, oh my goodness, you would be a great candidate for Quo. And so we're just going to do a few injections on her to show you guys the technique, show you what it looks like. She's very nice too, so that makes us like her. If she knew how pretty she was, it would not be good.
I was actually getting my lips done and I was watching the video and I was like, Chrissy, wait a minute. I want to do that.
I know, we're looking at more booties here. It's supposed to be about face, but we have really been all about the bomb lately.
Yeah.
About face and booty.
So we've already marked her a little bit. Some of the spots are just going to get one injection. Sometimes we have a little bigger spot, and that's going to get 2 injections. So, okay. So her first injection, we're just coming straight in.
And so what we're trying to do is catch those little fibrous bands at each angle. So she's going to be going straight in. She'll go towards the head and do a little injection. This is a tiny needle. This is 30 gauge, and 30, I think 34 is the smallest you can get, and that's pretty frail. So,
You
Lori?
barely feel it.
Yeah.
Does it hurt?
She wasn't. She's like,
Everybody's watching her. Watching.
Your backside is fatty, and so that is helpful with the needle, right? Much fattier than the face.
Right.
Right.
You might feel a little pinch here or there, depending on the nerve endings, but it's not probably painful. So.
No, not at all.
And Kelly, so Kelly is our staff person who we've been working on for the past couple of months. And so and Kelly agreed to let you guys see her pictures, which I think is just a wonderful person. That's awesome. So I'm going to show you her pictures because she shared with us her results. She's getting really excited. So just tell us a little bit about your experience with this.
So I would have to agree. Earlier Brittany mentioned that for the butt, it's like Botox for the booty. So if you've ever had Botox before, you know how minimally painful it is. It's over really quickly, and that's exactly what, in my experience, it was like for the tushy area. And I did get some bruising as well, but after I'd say 24 hours or so, I didn't really even feel sensation when I sat down. The second round we did butt and thighs, and the thighs were definitely more tender. I had more bruising on the thighs, and there's more injections for the thigh area as well. So, and thighs were my main concern as well. So they treated them nice and thoroughly, and I've gotten some great results, which you'll see just with the one treatment on my thighs. I haven't even had the full 3 on my thighs yet. So I'm due for 1 more for the butt and 1 or 2 more for the thighs.
2 more.
And then, so just keep in mind what you're seeing is the middle of the progress, not even the full healed results. So you'll still see some shadowing and some bruising as well.
You put numbing cream on the back of the thighs, did you say it does hurt a little bit more on the back of the thighs than the butt?
We could use numbing cream. It's really, I mean, we could absolutely do that, or we could use some ice.
Low tolerant.
And I mean, I'm very considerate of, because I'm the biggest wimp in the room, so I'm always going to make sure you're comfortable. But, you know, traditionally they don't, so we didn't. But if Kelly wants me to, I'll be glad to put some numbing cream on her or ice. We've tried, sure, you know, let's give it a go.
Is it like Botox where you have to keep having repeat?
No. Now, because it is newer, we can't give you that infinity because it's been studied now for a couple of years. It appears that those dimples will not come back. It appears that those striae will not come back as far as we know, right?
Right, so what I mentioned before is your cellulite is indicated by hormones and genetics. And I always like to kind of level set. Nothing is permanent. Truly, if anyone tells you anything's permanent, they're lying. Even your facelift, if you get one at 50, you have the natural aging process. So I do like to level set expectation. What we know is the cellulite that is going to be attacked by quote, it is not like a Botox where you're coming in every 3 months. This is an enzyme that is dissolving septate, where Botox and filler is literally a product that's sitting in the body being metabolized. That's the difference. This is not a product that sits and as soon as it disappears, you need to redo it again, if that makes sense.
Right.
Depending what phase you are in your life, you may have touch-ups. I always say if you're 30 and you haven't had children yet, we know that's a huge hormonal roller coaster. Is it likely you may create new cellulite and want a touch-up? That could be, but it isn't a treatment that you come in every 18 months and have done.
Right. That's a good point. Another good point is that whenever we purchase Quo, we purchase based on what we see, but some of those dimples are already gone on Kelly, so when we go back, we're going to be treating even more. So I think that's a nice way that you get such a nice clear surface there. So, Laura, you doing okay?
Yes, it's fine. It's tiny pinprick.
Okay,
It doesn't.
that's
doesn't really
good.
hurt at all.
Not like getting lips or face
No,
done.
Lips are a little more challenging.
Yeah. All right.
They're a little.
I like how
They're a little bit more.
It's very,
A little
But
more
they're
challenging.
also worth it.
That's like calling somebody colorful.
Yeah.
Yes,
Or
we're
she's got a
special.
colorful personality.
Yeah.
Yeah, we know what that means.
Or you're special, you know. So generally, when we're done, what we do, we just, the patient lays prone 5 minutes. That's to let that product, I like to say, kind of marinate. But it is such a surface injection that we do have them lay 5 minutes. And that's it, y'all. I mean, this is truly a lunchtime procedure and kind of like magic. It's phenomenal to see how
Yeah.
quick it is.
Yeah, and it truly, I mean, we're going to schedule you longer than 10 minutes because we do want you to stay with us and lay still for just a little bit. But truly, we could schedule these for 10 minutes. It is amazing how fast it is.
And then the fact that you can work out afterwards,
Yeah.
and it doesn't really. That's
Right, yeah. I want to show you some of Kelly's photographs real quick. So this is Kelly before and Kelly after the second treatment, and it's not even completely after the second. This is just after the first treatment, actually, right?
Is that your first?
Yeah, no, it's a little bit after we did the thighs, right?
Yeah, so it's after my first treatment for the thighs or my second treatment for the thighs.
For the bottom. So you see how she's already starting to be a lot smoother.
Like 21 days or something?
Yeah. It's probably more like
43 days.
43 days, okay. And everybody's different, you guys know that. I mean, I would say in most of the clients we've seen, they've seen some significant change after the first treatment. But as with, those of you that have seen us for Vivace or the other things that we do, chemical peels, sometimes you're not going to be seeing it immediately, and that's why we have those 3 treatments. So it just takes a little patience, but we've had nobody disappointed. It's been very fun, and that everybody's been pleased with the progress that we're seeing.